Hello and welcome to the IPE Effective Planning and Evaluation of Activities. This is brought to you from the University of Saskatchewan College of Nursing. Throughout this module, there's going to be numerous objectives for learning. We're going to look at what is IPE and provide the IPE competencies. We're also going to describe effective strategies to plan and evaluate IPE activities. We're going to use the PIPES tool, explain its relationship to exposure, immersion, and mastery, and then provide some examples. This module for effective planning and evaluation is going to take a look at different strategies in order to incorporate IPE activities within courses or evaluate the IPE activities already in place in order to make them more robust. In order to understand interprofessional education, we have to have an idea of what that means. So IPE assists to educate our students regarding collaboration with other professionals. This assists to develop the necessary skills to collaborate with other professionals and deliver patient-focused care. IPE is defined by the Center for Advancement of Interprofessional Education as two or more professions learning with, from, and about each other to improve collaboration and the quality of care. The Canadian Interprofessional Health Collaborative developed a national interprofessional competency framework that outlined different competencies that professionals should strive to achieve. These competencies are listed in this slide: interprofessional collaborative leadership, interprofessional communication, patient, family, and community-centered care, role clarification, team functioning, and interprofessional conflict. If you need a review on these competencies and interprofessional education, you can look through the module of Essentials of IPE or look at the College of Nursing Interprofessional Innovative Practices. As with any learning activity, there needs to be effective planning with a goal in mind at the end of our activity or course. So with interprofessional education, this is no different, and we have to attempt to try and weave it throughout our activities and design of our courses in order for our students to come out with an idea of what collaborative practice means. So in regards to specific planning regarding IPE, we always want to begin with an end in mind. Incorporating different learning objectives specific to the IPE competencies will assist to do this. The competencies provide the context to embed the health condition or management of health and illness. The focus and objectives of learning should be concentrated on the IPE competencies outlined previously. One error in designing an IPE activity can be focusing on the learning objectives related to the knowledge, such as the diagnosis or management of a particular condition required for a course. As all healthcare professionals have specific learning objectives for their students in order to learn and become effective practitioners, IPE can be incorporated and woven throughout in order for the team to have a collaborative practice. Some additional considerations regarding interprofessional education and competencies is to ensure that the learners have a foundational knowledge of what IPE is and what it means. There's going to be a great diversity amongst the learners, and this is just reflective of real life experience. Shared learning allows for a process consistent with interprofessional education. So students are able to work through those IPE competencies, still learning from, with, and about each other. It is understandable that this task of incorporating IPE into all of our courses for healthcare professionals can be daunting. So some practical advice is to start with a small group of learners, possibly 2 different sets of health science students, to try and incorporate the IPE competencies and focusing on the individual specific learning objectives of each practitioner. Try to develop learning objectives and goals with the other health disciplines and focus on possibly 1 or 2 of the competencies at first. Model interprofessional behaviors while working within the team and work with the other professions in order to develop the innovative strategies incorporating IPE. When we take a look at evaluation and planning, in the literature, it's been outlined that the use of a standard tool to assess and evaluate IPE activities is optimal. That way, all of the practitioners are on the same page and speaking the same language regarding interprofessional education and its competencies. Knowledge regarding the development of effective IPE assessment and evaluation methods is continuing to expand and broaden the horizon of how we can effectively use these tools and specifically develop them for our population here in Saskatchewan. This is an example of different methods and instruments used for evaluating programs that teach interprofessional education competencies. It was based on an overall literature review and results of interviews with research leaders in IPE to determine different assessment methods.
The PIPES tool is used by the University of Toronto Centre for Interprofessional Education. It's an objective tool that helps guide interprofessional education activity development and assist in defining the quality to set the bar and provide clarification. The criteria are then divided into 2 groupings. The first one is the process. This refers to how the learning occurs. 3 process criteria must receive points with a minimum of 15 points. The second step is the content. Here, the focus is on what is being learned in the activity. Again, 3 content criteria must receive points to be included with a minimum of 10 points. The tool is quite easy to use as the criteria is clearly defined.
The points awarded are based on process and content. They will help to ensure that the students are getting the proper learning activities to complement the goal of the IPE activity, depending on if you're wanting exposure, immersion, or mastery. The points allotted are on a 3-point scale, with 0 points given for little or no IPE focus. 5 points are earned for an acceptable or moderate amount, and 10 points being the maximum when there is a strong IPE focus to the learning activity. As described before, the process is related to how the learning occurs. The points are given from 0 to 10 as described, related to interactivity, number of professions with IPE educated facilitators, number of professions represented in the student participants, and then the frequency of interactions across the learning activity. So if a group comes back together to grow and expand their knowledge on interprofessional education greater than 3 times, then they would be given 10 points. The content in the PIPES tool focuses on what is being learned. So realistic and authentic learning activities where the IPE activity is planned from 0 to 10 points. If it's more realistic and it's actual in real life, then you would receive more points. Explicit IPE learning outcomes refers to the number of IPE competencies being addressed. And case-based learning involving specific in-depth dialogue would receive more points.
Once the process and content points are totaled, the activity can be grouped into 3 colors: red for exposure, orange for immersion, and green for mastery. This slide describes a relationship between collaborative practice and IPE, with the goal of building from the exposure level up to mastery as a student moves through the program. I would like to discuss how the activity in Nursing 431 can be applied to the PIPES tool. In the 4th year of nursing, students are working in a clinic environment with other healthcare students and providers where a team approach is emphasized. I would like to explain how the points were allotted and how the score was tabulated. So 10 points were given as the activity was highly interactive. 5 points because there's often 1 or 2 professions with IPE education. There are often several professions involved with the student, and so 10 points were distributed here. And P4, the activity happens greater than 3 times. So in terms of frequency, 10 points were allotted here for a total process points of 35. The second section of the PIPES allocation tool is the content section. Under C1, 10 points were allotted as this activity is authentic and very realistic. C2, as there was 3 constructs met, 10 points were given. Debriefing always occurs after the IPE learning activity. Frequently, it's an informal debrief, so 5 points are given, and on occasion, a formal debrief occurs. As it is case-based learning, the maximum amount of points of 10 were given, so the content points total would be 35 with the process and content. Total points equals 70, showing as a green and mastery level. The next example is a rural example that was piloted in Humboldt, Saskatchewan. Here, the underlying principle of the project is to work with communities in developing and implementing sustainable IPE initiatives that meet the needs of the education programs as well as the community. Here you will see how the PIPES tools was applied to this particular rural activity and how the points were allotted. Under P1, as the activity is very interactive, the full points were given for 10. The number of professions with IPE educated facilitators has a score of 0 as one facilitator is involved. Often there is various professions involved from medicine, nursing, pharmacy, and nutrition, and physical therapy. Again, full points of 10. And P4, the frequency of the interaction across the learning activity. As the learning activity occurs once in this experience, 0 points for a total of 20. When looking at the content portion of the activity, C1, the activity is very authentic and realistic, receives 10 points. There are no specific IPE learning outcomes, so no points are allotted for C2. Informal debriefing happens with the students and facilitators and receives 5 points. And as it is a case-based learning situation, the full points of 10 are allotted for a total of 25. When you tally the process and content points, we get a total of 45, and this falls into the exposure level.
In conclusion, the IPE planning and evaluation using the PIPES tool can assist with collaborative practice. IPE is necessary in the dynamically changing healthcare system of the 21st century, and these tools can assist us as educators to ensure that people understand the interprofessional competencies and how to integrate it into collaborative practice with healthcare teams, families, patients, and communities. Suggested use for the IPE planning and evaluation could be in clinical environments, in class, with healthcare teams, advancing your own individual understanding of IPE, and in order to advance activities from exposure to immersion to mastery, ensuring that our students have the right tools and capabilities in order to go out and ensure collaborative practice while they're professionals.